My name's Randy Clare, and I'm president of Hawkeye Group. I'm here today to answer some questions that we're getting from the field, and everything that we care about here is associated with chronic conditions. And today, the issue is bruxism. Bruxism is clenching and grinding your teeth, thrusting your jaw, making noises and whatnot during the night with sleep bruxism. And one of the things that we are very concerned about here is the treatment of chronic conditions can quickly lead into lots of pharmaceuticals, opioids, all these sorts of things, depending on how severe the case is. And this is very appropriate for patients who require it. But are there other choices? And some of the other choices are really about treating the condition before it becomes an issue. So we developed ClenchAlert. ClenchAlert is a very simple little device. You just wear it in your cheek with this little bite wing in between your teeth. And when you clench down, which of course is a hallmark of bruxism, you clench down, then it vibrates and it just lets you know that you're having a bruxism event. And so this is a time for you to check your jaw position and understand that you need to maintain lips together, teeth apart, relax a little bit, check for your anxiety, check for your stress level, and decide that you're going to do something about that. Get up, have a walk, these sorts of things. But one of the questions that keeps coming up is, as we pursue non-pharma solutions, of course, it's not a one-size-fits-all situation. So what we want to do is find the right combination of things that push off that acute phase that requires pharmaceutical intervention. And of course, everybody is aware of that now. So we'll just go down that road here. So today, we're going to be answering some questions that came in from users of ClenchAlert. And people are asking us about nutritional supplements. What kind of nutritional supplements should they be pursuing? And the first question that I'm going to answer today is, how should I communicate with my healthcare provider about bruxism? Well, first of all, you want to describe your symptoms. Do you have jaw pain, earaches, neck pain? Do you have tension across the muscles around your head? This is the temporalis. This is the accelerator. This is the gas pedal for tension headaches, is this muscle here. But what's fascinating about this muscle to me, I've been doing this a long time and I'm still fascinated by it, is this muscle cannot fully engage unless this muscle, your masseters, fully engage. Well, these muscles are your primary clenching, closing, chewing muscles. So when you clench your teeth together and your back teeth come into contact, you can feel a little bulge come up here. Okay? So this is all tied together, all of this musculature. So headaches, jaw pain, sleep issues. All of a sudden you're feeling sleepy in the day. And what we're really looking for when we're talking about symptoms like this is we want to make sure that we're communicating to our healthcare provider in a way that they can understand what it is that we're trying to convey. So keeping a journal is absolutely fundamental to treating your own case. Keep track of when you're feeling the pain, describe the pain, acute, sharp, throbbing. Describe it clearly. Keep track over time. That's really key, because what we're looking for is real subtle changes. And we can find that, whenever I eat certain foods, or whenever I chew gum, or whenever I stay up too late, or maybe I drink a little too much alcohol, all of a sudden it sets off a cycle of pain and you'd like it to stop. This is a way to do that. By keeping a journal, you're able to spot triggers and trends that you wouldn't otherwise be aware of. And so this is a really good way to go. Now, when you're talking to your primary care physician and you're talking about bruxism, headaches, earaches, these sorts of things, one of the things you might want to ask for is, when you do your blood panel, you want to ask for tests to check for your magnesium levels, vitamin D, iron, B vitamin levels. These all can help for identifying underlying deficiencies that can contribute to your to your bruxism. So, for example, magnesium. A low magnesium level can lead to muscle spasms, jaw tension, tightness, and soreness. A vitamin D deficiency can lead to muscle stiffness, mood disorders, these sorts of things. Calcium, if you have an imbalance in calcium, you can get cramps, you can get all kinds of stiff and fatigued jaw muscles. And all of these things work together because, of course, you're feeling anxiety from other things. You stop eating well, and all of a sudden you find yourself getting into this situation. Another question we got that I liked is, what are some easy ways to add bruxism-fighting nutrients to my diet? Well, you can try a spinach and almond butter smoothie, and that'll give you magnesium. Grilled salmon and sweet potatoes will give you vitamin D. Lentil soup will give you lots of B vitamins. And you can prep snacks like trail mix or boiled eggs to keep nutrient-rich foods at hand. Because if you're going to use food as medicine, one of the key parts of that is to make sure that you prep. Now, meal prepping, we're all familiar with hearing about it by the really athletic folk who are low body fat and all those sorts of things. I've never been at risk of being part of that group. But anyways, doing a little food prepping helps a great deal. One of the things that my wife and I actually do is we will boil a whole carton of eggs and just put them in a bowl in the fridge. They're ready to go. They're pre-wrapped. You can just crack them and eat them, and life is good. There's your protein. There's a tremendous amount of vitamins in that, and not only that, but it's ready-made. So, okay, I'll share with you my recipe. So here's what I do. I get the water boiling. Then I take the eggs, and when the water's boiling, then I put the eggs in. I've got a little strainer basket that I drop them in with, leave them there for 12 minutes, pull them out, and put them in an ice bath so they immediately stop. Because for me, I'm telling you, boiled eggs with that green ring around the yolk, not so good. So I had to find a way not to get that part, or the part where you boiled it until it's really just like sawdust with a white outline. But now I'm talking about me, and it's really about you. So anyways, how can vitamin deficiencies cause teeth grinding? Well, it's really just about creating the perfect storm. When you have low nutrient values, then clenching, grinding, muscle spasms, all these sorts of things are going all over your body. But we're talking about a person who's got a history of clenching and grinding. So when they clench their teeth, what happens is you're clenching not just in response to the parafunction that you already had, but now you're reacting to muscle spasm and all that sort of thing that is exacerbated by your low nutrient value of the food that you're eating. So that's something to bear in mind. Shout out to everybody who sends in questions. If there's something that you would like me to cover, please just go to ClenchAlert.com. ClenchAlert.com is going to be the best. We've got a blog there. You can read some of those articles, but also it's a great place for you to send us in a question. So here's a big one. Chronic pain. Chronic pain is one of those things that you really want to manage with a great night's sleep. And how do you get a good night's sleep? Well, you get a good night's sleep by preparing to sleep well. And so how do you do that? You've got to turn off the cell phone and the iPad and the TV for about an hour before you go to bed. It basically lets your entire brain and everything kind of relax a little bit. I have a rule in our house. It was a hard sell initially. We don't have a TV in the bedroom because laying there watching TV, rev your brain up. Now you're ready to go to sleep. You turn off the light and roll over and think that you're just going to fall right to sleep. What happens is, you go to sleep. But it only looks like sleep because it takes a long time for your brain to actually decompress to the point where you're actually getting fulfilling sleep. The other thing is giving yourself the opportunity to sleep 8 hours. If you don't give yourself the opportunity to sleep 8 hours, you never will sleep 8 hours. And 7 to 8 hours is ideal for a restorative sleep cycle. And better than that, If you are part of the group of people that suffer from chronic pain, you need to sleep well so that you can manage your condition. It's probably the best self-care that you can do. Eating well, get lots of protein, get lots of fiber, drink lots of water, but concentrate on magnesium, vitamin D, your complex B vitamins, calcium, iron. This is what we're talking about today, and I'd like to thank you very much for joining me. We keep it short and sweet on these Q&As. Thank you. We'll see you next time.